Let's get you the latest details on the story we watch very closely today, the spread of the coronavirus. A couple of big developments in Beijing itself. Officials have started to cancel major public events, including some of the Chinese New Year celebrations. They are scrambling to contain the spread of this new and deadly coronavirus. We're already talking about the big lockdown, the quarantine in Wuhan, which is the epicenter of the outbreak, as well as two nearby cities. In Geneva, we're just now hearing from the World Health Organization again. Officials have set the time for their second meeting. It will be 1 o'clock Eastern. This is when they look at the latest information and consider whether to declare a global health emergency, a public health emergency of international concern. The number of cases continues to grow. Let's look at some of the numbers. 17 dead now and nearly 500 cases.
We need more information. For that reason, I have decided to ask the emergency committee to meet again.
Sorry, that's the WHO referring to what I was just saying. That was yesterday's meeting when they did not declare an emergency. Again, they will meet this afternoon. Eastern. 17 dead, more than 570 confirmed cases, all of the deaths in and around Wuhan. About a dozen cases have been reported across Asia and one in the United States, that in the Washington State area, Seattle. There are 5 people in Quebec, Montreal and Quebec City in quarantine and being tested. So that pretty much brings us up to date on what is happening with this new coronavirus. I want to bring you a very important perspective, I think, on this, because we think of this new virus and some of the issues around it. Think back to SARS when it arrived in Canada, and one of the people whom you saw almost, well, I would say every day for a very long period of time. He was really on the front lines of SARS when he was involved with the University Health Network. Dr. Michael Gardam, he is an infectious disease specialist. He's now the chief of staff at Humber River Hospital, and he is watching this very, very closely. So we join him in Toronto this morning for a little bit of a comparison. Dr. Gardam, it's great to see you again, and thank you for making some time for us today.
Thanks for having me.
Before I jump back into SARS, I'd like to start with some of that breaking news. Really some extraordinary developments this morning. The lockdown, the virtual lockdown of Wuhan, a city of 11 million people, 2 other cities now, and some of these other cancellations. What do you think of the measures that China is now taking to get this virus under control?
You know, those measures are the kinds of measures that we in hospitals and public health have used for centuries, right? If you've got an outbreak, you really try to contain the outbreak. What's really different here is the volume of people, the number of people this is affecting is really, we've never seen anything like that before. So, you know, the measures make good theoretic sense. It's really remarkable how many people are going to be impacted by this.
It's interesting how you describe it, theoretic sense. The WHO has just said this is all new to science, and we don't have really a gauge to measure whether this kind of extreme response is going to have any effect. So, again, in the theoretical. But I'm wondering if it's also, if we can look at it in the context of China as a whole. One of the things that I know was an issue for you in SARS and for us trying to get information is China was not forthcoming at all with information about SARS. And it seems that that has changed this time. What do you think about the quality and the quantity of information we're getting about this new coronavirus?
Yeah, it is absolutely different. If we think back to SARS, right, we were getting snippets of information to the point where by the time we finally realized there was something significant going on, we already had cases transmitting here in the city, right? So that we were way behind the 8 ball during SARS. In this particular case, I think China has been much more forthcoming. And I think also these measures that they're taking, which may have an impact because this virus is not that easily transmissible, they may very well have an impact. But, you know, the fact that they're doing that, I think they're also doing that for the benefit of the WHO to say, listen, we're really trying to contain this. Please do not declare a public health emergency, because that will have significant impact on the whole country.
What impact would it have?
Well, basically, I mean, if you remember back to 2003, the WHO issued a travel advisory against Toronto, and the impact on the city was quite profound. I mean, we lost billions of dollars during that time. So imagine declaring something similar for an entire country and the kind of impact that that could have. It would be huge decreases in people visiting, et cetera. I think that there would be a lot of issues that would impact China. And so, like Toronto back in 2003, where a group went to the WHO to try to argue don't issue travel restrictions against Toronto, China is likely doing exactly the same thing.
It's interesting, too. People within China are really clamoring for more information. You're hearing it from the public and from health officials. They are demanding that people not keep this concealed this time, which is interesting. You mentioned the WHO. Let's turn to it. 1 o'clock this afternoon, Eastern Time, we will get this second day of meetings. We heard that clip saying they're looking for additional information. What do they need to know at this point, Dr. Gardam, to make an appropriate decision?
I mean, their biggest question in front of them is how, like, trying to predict the future, right? How transmissible is this virus? And is, what we're seeing now, is this something that's going to be a bit of a flash in the pan? And now that we've identified it and we have a test, it starts to wane? Or is this something that has legs, which is really going to start to spread? If it's the latter, then, there's going to be enormous pressure on the WHO to take this very, very seriously. The challenge is right now we're in that really difficult part of an outbreak where you don't have all the information yet, and you're just going to have to make a call.
We'll see if they do that this afternoon, Eastern Time. Even though we are in this period of limbo, as you put it, it seems that Canada, if we look to our own response, is already set for whatever may come. If we look to the airports, we're seeing the screening, but I want to focus with you particularly on the hospital setting with which you are so familiar. Is that right? Is it a much different reality now for this than it was for SARS?
It is honestly like night and day. If you think back to 2003, I had just started my career in 2003, lucky me. And, the issues that happened to us in Toronto at that time, there was no easy way of public health notifying us what was going on. We didn't know what the virus was. We didn't have a test until halfway through the outbreak. Hand washing was something we really weren't focusing on. We didn't have good supplies of personal protective equipment. It goes on and on and on, the stuff that we were not prepared for. And we literally made it up day by day. I mean, you would see the various press conferences coming out of the ministry where people would be speaking and the rules would be changing day after day because we just didn't have enough information. You fast forward to now, and Canada learned a lot from SARS and even more from H1N1. Hand washing's a thing everywhere. We all have stockpiles of personal protective equipment. Our staff have all been trained. We've been doing screening for travelers and people with fevers for well over a decade now. So when people ask me, what's going to change tomorrow if the WHO makes their announcement, the answer is not very much. And that, to me, is fantastic news. I think if there's any country out there who is as prepared as it could be, it's actually Canada.
That is reassuring to hear from someone like you. And yet, we've been showing pictures this morning, scenes in Vancouver, empty shelves where there are supposed to be face masks. People at any illness that resembles SARS, people are concerned, and they're doing things like buying masks. I'm wondering, as we conclude this conversation, I hope we'll have more, but people who haven't just come back from Wuhan, people are not going to Wuhan, the general public, what do we need to be doing right now, Dr. Gardam?
Yeah, right now, the answer is nothing new. The messages that we've been giving people, during flu season of washing your hands, stay home when you're sick, that sort of thing, absolutely nothing has changed. At this moment, the only group that we're worried about are people who have had direct contact with Wuhan. That's it. Now, that may change over the next week if these control measures in China are not successful and we start to see lots of cases in other parts of China. That may change. But right now, it's really a very specific population. You got to remember, China's got 1.4 billion people, and we're talking, 500 right now. So it's very small still.
But it does explain the potential for spread in all of those numbers and why they're acting so aggressively to get this contained. Right. Dr. Gardam, first of conversation, but as you say, in this period of limbo, as this sorts out, I have a feeling we'll be speaking again, and I look forward to it. Thank you.
Me too. Thank you very much.
Dr. Michael Gardam, now the Chief of Staff at Humber River Hospital. He joined us in Toronto this morning.